Hello, everyone, and welcome to our Spotlight series, where we share current trends on the critical role resilience plays within organizations. I'm Pam Boris, your host and Chief Marketing Officer here at MeQ. And joining me today is Dr. Adam Perlman, Chief Medical Officer and co-founder of MeQ. Welcome, Adam.
Thanks, Pam. Great to be doing this with you.
Yeah, let's jump right in. The mind-body connection is powerful, and stress and burnout can have significant impact on our overall health. What physical symptoms and impacts might manifest from stress and burnout?
It's interesting. I think we all know on some level that there is this strong mind-body connection, although quite frankly, the Western medicine was really founded on this more philosophical principle that the mind and body are really separate, Cartesian dualism. And I think in the last few decades, we've come to fully appreciate that there is this intimate connection. And yet, even in my clinical practice, I see patients that come in with various complaints that don't fully appreciate that a lot of what they're complaining of or dealing with from a medical condition may be driven, at least in part, by sort of their emotions, the stress they're experiencing. And so we see everything from sort of complaints such as I'm feeling pain or I'm feeling fatigued that may be related to the stress they're experiencing. But also we know that stress can really increase the risk of developing many of the diseases that plague society today. So, certainly depression would be no surprise to the audience. But when you are really stressed and not managing stress effectively, it can increase your risk of heart disease, stroke, high blood pressure, a number of conditions that are actually some of the more typical conditions we might see, in a primary care practice. Yet we're often not aggressive enough, let's say, in treating sort of the stress itself, because we often fail to remember or recognize that it really may be an underlying driver of whatever the particular individual is suffering with.
Adam, it's so interesting that you say that in your practice, you see a lot of complaints and issues that have a stress component. Can you tell us more about that?
Sure. The approach I take is, of course, to do all the right things medically and look at what the potential causes may be and what the potential sort of recommendations may be from a conventional. And of course, I also practice integrative medicine, so I'll even look beyond the conventional. Is there medications? Are there other interventions that are required? But from the perspective of looking at stress, first you have to ask the person, you have to engage in that dialogue. And then people often recognize that stress may be a component. So then it becomes, how do we teach them to be more resilient? Often when people think, well, stress is an issue here, their minds go to a place of, well, how do I get rid of the stress? But that typically isn't the answer. There are certainly events, things that go on in our lives that we're better off trying to remove from our lives if we're able to do that. But very often, it's really not about removing the stressor. Let's talk about this video here, right? I wasn't overly nervous, but if I was really stressed, one answer would say, no, I refuse to do this. But this is part of my mission in life, is to help educate people on how they can be more resilient, better manage stress, optimize their health and vitality. So, how do we learn to be more resilient? How do we sort of use that event that feels somewhat stressful to say, all right, well, what am I going to do? I'm going to, emotionally regulate myself and realize that I'm done presentations before. I'm sure this is going to work out well. I'm going to prepare, to the degree that I need to prepare for whatever the presentation, in this case, the video may be, and really work towards that place where, even though it may be stressful, I'm feeling resilient, I'm feeling strong, and ideally confident that I can do the job.
A great example of something we say at MeQ all the time, which is that we can't control the things that happen to us, but we can control our reactions to them. So great example of that, Adam. Thank you. And remember, by cultivating a resilient workforce, we create a culture of adaptability, innovation, and growth. And MeQ is here to partner with you to drive sustainable long-term success. What steps have you taken to build a more resilient workforce? Share your thoughts at events@mequilibrium.com, and let's continue the conversation. Please visit resilience2023.com to learn about all of our upcoming programming. Thanks again for watching. We'll see you next time.